Good afternoon, everyone. My name is Sean Egan. I'm the Director of COVID Workplace Safety here in the state of Michigan, and glad you're joining me today to talk about a new program we've launched within the Michigan Department of Labor and Economic Opportunity related to restaurants called our Safer Dining program. We're going to jump into some details about the program and what we're looking for and why. It's available now at Michigan.gov coronavirus under the Safer Dining link. You can definitely check that out. A couple of things to keep in mind, as I often mention, social distance, face coverings, good hygiene have been consistent throughout this pandemic as a way that we can contain our spread. We've done a series of HVAC focused webinars to talk about the challenges with indoor environments and COVID, and some of those concepts are going to be in this. Just want to reiterate that this is a voluntary program for restaurants out there to help ensure that they're taking an additional step to mitigate the spread of COVID. So as I mentioned, this is a completely voluntary program for restaurants to just check with their HVAC contractor, licensed HVAC contractor, or an engineer to inspect their ventilation systems. And there are some recommendations in the checklist to help you accomplish some of the things that I'm going to mention. So this information and the checklist was developed based on the best guidance that we have from the CDC, the Environmental Protection Agency, and ASHRAE. ASHRAE, for those that don't know, all of the HVAC contractors should know them, is the American Society of Heating, Refrigeration, and Air Conditioning Engineers. They write codes, they write standards, and they put out some COVID-19 guidance early in the crisis to help all types of workplaces and businesses understand how HVAC systems, fresh air, ventilation, and other things can impact the spread of COVID in their workplaces. And you'll also need to make sure that you post the MDHHS Dining During COVID poster that is available on that same website under that link. We haven't received any final yet, but I just want to always point out that Governor Whitmer has proposed $10 million in the supplemental budget request that she put forward a couple of weeks ago to support this program through MIOSHA. That's in the legislative process, so those funds aren't available, but we're hopeful that that'll happen to help further push out this program. So over the last several months, we've done a series of HVAC focused webinars based on these concepts, and our friends at ASHRAE have helped us throughout, Michigan ASHRAE that is, have helped us throughout the process. And you can find these slides and this information on a link that I'll share with you later. But what we're shooting for here are a few basic concepts. They're ventilation, filtration, and humidification. Really where they focus in on that can help us mitigate the spread of COVID in indoor environments. And in the checklist, you're going to see these things talking about air changes per hour. And as you can see from this chart, this is developed based on some math around other viruses that we know spread through aerosols and how air changes per hour of fresh air can impact the probability of that virus hanging around and being able to infect somebody else in that same indoor environment. When we think about places where people are already sick, if we think about operating rooms and others, they're going to be way down this graph into that 12, 14 or more air changes per hour to really lower that probability of infection. So when you're working with your HVAC contractor or professional and looking at things that you can do in your workplace, this is one that we really focus on. And we didn't put a specific number, but you can see if you get to 2, 4, 6, 8, that probability just keeps going down. And these are outdoor ventilation air change rates. So you're pulling in more outdoor changes per hour. So to picture that, if you think that if you get to 6 air changes per hour, in theory, every 10 minutes or so, you're changing out all the air in that indoor environment. Now, it doesn't really work that way because it's how the system functions, how long it's on, and all of those types of things. But when you're looking through the checklist and trying to understand what we're shooting for here, these are the types of concepts that we're pushing for, and your HVAC contractor should be able to help you understand this. We didn't put a specific number because code requires different amounts of air changes per hour depending on what type of operation you're running. And some systems can't handle these types of changes, and we have some tools in the checklist that you can do if your system can't handle these types of changes. We also talk a lot about filtration, and you keep hearing this MERV 13 or better. So MERV is the efficiency rating on a filter. When you think of HEPA, like you can get on your vacuums, there are HEPA filters for HVAC units and other things. That is sort of the top of the line. It removes just about everything possible from that. Most systems cannot handle that type of filter, not without significant changes anyway. Many systems may not even be able to handle a 13 or better. But 13 in that efficiency rating is where you start getting into a filter that's strong enough to start pulling out some of the smaller virus if it's recirculating around your business. 14's better, 16's better, all of those, the higher you get, the more filtration you're going to get. On the flip side of that, a lot of your equipment has to work harder if you're going to be filtering to that degree. Many systems are designed for 8s, 9s, those types of filters. So your HVAC contractor should be able to tell you if your system can handle it, and that is going to be one of the options in the checklist. And then humidification, probably one of the more difficult pieces of this checklist, is trying to get that humidity to the optimal range. The virus, when it becomes aerosolized, clings to something. It doesn't have wings, right? So it clings to something to get around. Often that's going to be water. If we keep our humidity levels in the optimal area, it's going to help it fall to the ground quicker and not get as small. The smaller it gets, the longer it can sort of hang around, and humidification is an important tool. The optimal zone is somewhere between that 40 to 60%. 60% sort of in the summer or lower, 40% in the winter or higher. In Michigan, it's hard to do that because we have very low humidity winters, and it makes it challenging to keep the area comfortable and otherwise, but there is an optimal zone for you to consider. And again, your engineer or HVAC contractor should be able to help you if you can do that type of thing. So the certification itself is relatively simple. The owner operator has a small section that they're going to fill out. You're going to put in your MDAR license number, your address, your business name. You're going to make a couple of attestations there, and that's going to be that you've implemented the MIOSHA emergency rules. You have the plan in place and those types of things. So you're in compliance with the DHHS orders, and you've posted that Safer Dining poster or Dining During COVID poster. And then the HVAC contractor or engineer professional is going to have a section that they're going to fill out. And that's broken into 3 options. Now, we call them options, but our goal here is that the contractor is going to take you to option 1 if it's possible, option 2 if that's possible, and then option 3 if you can't do the other 2. Option 1 is for those systems that can handle that MERV 13 or higher filter, and they're operating as designed and bringing in the fresh air as they're designed. We're hopeful that HVAC contractors recognize what we just shared and will push those air changes per hour up if it's possible and still be able to remain comfortable in there. The code for buildings is going to be a little bit different. So some environments, as long as the system is operating appropriately, may already be hitting that 2, 3, 4, or 5 air changes per hour, but you have to make sure it's doing it. And then option 2, if your system can't handle those higher rated filters, that you're going to get to the highest MERV rating you can. And then there's some other components that you can try to do to make sure that you're hitting those, pushing those air changes per hour up and filtering the best that you can. And then option 3 is for systems where the owner or operator might not even control it. Think of a restaurant that might be part of a larger building, a strip mall or something like that, where it's maybe a central system that you're dealing with, or the system itself is old, outdated, maybe a boiler heat. Boiler heat is not really going to help a lot with air changes per hour. So there's other strategies that are included. The way I normally say this, and it's a little bit cheesy, but I'm going to say it anyway. You can buy a Ferrari or a Chevy Cruze to get to work. They're both going to get you there. And this is intended to allow you to have options, even if your system isn't the Ferrari or you don't have control. So we're not trying to exclude anybody, because there are things you can do to help make sure that we're mitigating the spread. It's important for me to note for you all, though, that this is a mitigation tool, not the only mitigation tool. And regardless of those places you look, like CDC and EPA I mentioned, it needs to be coupled with the mask wearing, the social distancing, closing congregation areas, and other things. This is intended to help us understand that when we have indoor environments, we need to pay attention to how aerosols or other things may be hanging around. So participation in this is really simple. You go to Michigan.gov COVIDSaferDining. You can download the participation form and checklist. You're going to work with your licensed HVAC contractor. If you don't have one, we do have some tools there of associations. We have links to utilities, and I'm going to mention a little bit more on that in a second, and links to Michigan Saves, which does financing. But all of those groups have contractors that they've already certified to participate with them with search engines, so you can find one if you need one. Part of our HVAC webinar series that we've already done has included the utilities and Michigan Saves, because if you're going to start making changes, changing, say, from a single speed fan to a variable speed fan, you may qualify for a rebate. And you want to definitely check with the utilities on other pieces of their rebate programs. Some have special financing if you're going to try to make upgrades, and other things that you can do there to see if they qualify. And those contractors listed in those programs already know how to do that. And then Michigan Saves is a nonprofit group that works with the utilities, the Public Service Commission, and banks around the state if you're going to make those types of changes where you need some support. We also have a nice link there to a piece that Michigan Saves put together that talks about these types of changes in sort of a range of costs. Now, be very clear, those range of costs is based on a survey that they performed with some contractors. And it depends on your building, it depends on your system, and it depends on several factors. But just to give you a kind of an idea of how those things may happen. So once you do that, you'll go back to the website, enter in the data through an online submission form, email in the completed and signed checklist, and you'll get a certificate that you can show in your establishment upon successful completion. Our goal there was twofold: to make sure that we give owners and operators and workers in those places peace of mind that everything's working the way that it's supposed to, but also to give your customers some symbolism that you're taking the steps that you can to help mitigate the spread of COVID. We know it's one thing to open back up, it's another thing to have customers confident to come back in, and we're hopeful that this can help you do both. Protect your establishment and your workers, as well as engage your customers in a way that they'll see that you're doing the things that you can as it relates to COVID. We have a lot of other additional support and resources. One thing that you should definitely check out, I'd encourage you to, is the MIOSHA Ambassador Program. This is a statewide free consultation program to different types of businesses, restaurants included, where consultants will come right on site and work with you to make sure that you have implemented all of the MIOSHA emergency rules. It's a very good program, very successful, it's working well. We have links to our series of HVAC webinars. I know I went through some of that information very quickly on what we're trying to accomplish. Those webinars cover it in a lot more detail. I would encourage you to check that out so that you understand what we're shooting for here and why in more detail than what I was able to give. And then also on our Michigan.gov COVID Workplace Safety website, we have guidelines, posters, fact sheets, videos, you name it. We have all types of things for businesses to make sure that you understand what the MIOSHA emergency rules are and give you the tools and resources to implement those strategies. And that includes a link to a template preparedness and response plan, which all workplaces in Michigan should have. It's for low and medium risk workplaces, which certainly includes restaurants. So if you don't have one of those in place, you can grab that template and work through it and make sure that you're in compliance. So with that, I will stop sharing my screen and we can go to questions.
Absolutely. All right, everyone, my name is Erica and I'm going to be facilitating the Q&A. If you haven't already, go ahead and use the little Q&A icon to submit your questions and we'll get to as many as we can. Sean, the first question we have comes from Brad, and he's asking, as a licensed PE, how can I make myself accessible to those looking for help?
So licensed PEs certainly are qualified to do these types of evaluations and can help many businesses with those concepts of air changes per hour, filtration, what the system can handle. A lot of this does have to do with building design and other variables that go into consideration. So certainly if you're holding yourself out as available, definitely make sure you connect with the customers and clients that you've already had. and certainly, posting whatever it is that you can do to help promote that. But I appreciate the question, and I don't have a better answer than that, but I appreciate you trying to jump in and help.
All right, and why would a restaurant go to the expense of upgrading their HVAC system to meet option 1 if they are still limited to same capacity limits as another restaurant that hasn't gone to this expense?
So one thing to keep in mind is that if you were going to upgrade your system, if you needed to do that and that's something you are willing to tackle, you may qualify for those rebates for portions of the cost, to keep that in mind. And you're also making this safer long term. We know we're in the vaccine, we know that we have variants, we know that there's a lot going on with COVID, but all of these types of changes make your building healthier anyway. So if you're in a position to take those steps, I would definitely encourage you to do that. And keep in mind that I recognize that not every restaurant's going to participate in this type of program, but those that do are taking that additional step to make sure that their place of work, their customers, and they're doing more to contain COVID in our communities.
Perfect. The next question says, I have read through the HVAC checklist. There's a lot addressed with filtration and air changes, but nothing said about inspecting HVAC units and connecting ductwork for conditions in need of possible cleaning. After all, this is the system that distributes the conditioned air throughout the restaurant. Why was this left out?
So we really focused in on those pieces that the CDC and EPA and ASHRAE and others had already put together. Those components aren't in there, but they are important, and we would hope that the licensed contractors could help businesses understand that.
All right, our next question is from TL. Is there any plan to reward restaurants who spend the money to get to 12 to 16 air exchanges per hour with perhaps an occupancy greater than 25%?
So as part of the program, as it currently exists, that's not part of the plan. So I don't know how that might change in the future. I don't have any crystal ball to tell you that, but I appreciate the question. I think that it's important. I understand the direction that you're trying to take that. Moving to 12 to 16 air changes per hour within a restaurant type space might be a challenge, which you might learn as you work with your HVAC contractor, but certainly an admirable goal. But even moving down that spectrum helps, as you saw in the probability chart. Now, this does not, when we think about HVAC systems, it's general ventilation, so it's not really going to have a huge impact on our close proximity when we're in a restaurant. When we're sitting across the table from each other, we're taking our masks off. Most of the spread of this virus is still through large respiratory droplets. Aerosols are a component, though, that does impact the probability of spread to people that are outside of that sort of 6 to 8 feet circle.
All right, the next one is from Chad Retch with IB Group Dynamics. Do you or ASHRAE provide this certification form? Where do we find these checklist items in a form, or is this a requirement for us, the contractors, to create based on these options?
So if you go to the Safer Dining link, the certification form is right there with the check boxes for different options.
All right, and this one's from Steve. Is the state recognizing bipolar ionization as an acceptable strategy for air treatment?
So recognizes isn't the right word. What I will say is that those technologies are not included in the checklist. And that is not necessarily because of anything to do with that technology, other than most of them are emerging. So we were focused in on long time known changes that have been studied over various, number of years and all that kind of stuff. So I think if restaurants are going to be considering those types of things, we're not going to say they're good or bad. I mean, we're not going to make a distinction that we don't have any problem with those technologies. We just don't have enough history to be able to promote them.
All right, and this one is from Joe McHale. After the business is certified, is there a plan for HVAC maintenance and filter changing the restaurants are required to do? If
the restaurants are working with their HVAC contractor, And for any restaurateur that is listening, a strong maintenance program on your HVAC system is already pretty much required, and it's important that you continue to follow up. I think when we start changing filters and filter sizes, that might change your plan. So you need to work with your contractor to make sure that you're on the schedule you need to be on to maintain compliance with this type of program.
All right, and is more humidity better?
So we're really focused in on that sort of optimal range of 40 to 60%. I've talked with restaurateurs or owners, across the state, other businesses, and in Michigan, we don't have a long history of adding humidification to buildings. Normally, our only is air conditioning is when we're trying to get it out of there, right? So a lot of locations are going to have a hard time kind of adding those types of things at a scale that can make it. So, but if you're in a position to do things where you can get your environment to that 40 to 60%, that is better.
All right, and we have a couple of questions related to finding a licensed HVAC contractor. So can you speak a little bit to, if they can use any licensed HVAC contractor and how they go about finding a licensed contractor?
Yes, when we built out the certification form and focused in on licensed HVAC contractors, there are several thousand in the state of Michigan that are licensed with the Department of Licensing and Regulatory Affairs. So there's a fair number. I think many businesses are going to have a person that they've been working with for several years. We didn't in any way want to exclude them. And we were focusing in on that license piece rather than providing contractor, just a simple list that we would have. So you can use any licensed HVAC contractor. If you've been working with them, that's great. You can continue to use them. If you don't have one, I would check out the Michigan, that Safer Dining link. We have a list there to a couple of associations in Michigan, and then all of those utilities that we have listed there have a find a contractor link where you can type in your address and those types of things. And those are pre-qualified contractors with the utilities as well.
Great. And do you have any advice for businesses heated with hot water radiators?
Sure. I think, again, one of the reasons we put those other options in there to try to manage some of these issues is that every place is going to be a little bit different. So that's certainly one that creates challenges. You more than likely have some type of fan system in there where you can increase your air changes. Maybe, I don't know, you'll have to check with your contractor, but there are portable HEPA units that you can place around your place of business that can have an impact on what air changes per hour look like. So you could consider those. I know if you're going to start bringing in more outside air with hot water heat, you're going to have a challenge there of maintaining a comfortable environment. So there are a few things in the checklist that you could consider, and I would encourage you to check it out.
All right, and this question comes from Patrick. Would public institutions operating restaurants qualify for the $10 million funding through the state?
We're watching that as it moves through the legislative process. We're not sure what type of parameters might be tied to it. So as soon as, if that happens, we'll be back on a webinar like this to talk about what that means.
All right, this one comes from Gordon. Do air ionizers help kill viruses?
That's another one where we're really not going to chime in from the state on the efficacy of those types of equipment. I think that the manufacturers have some good information that they put out there, but again, history and research they're emerging technologies, so there's not a lot of information coming from folks like ASHRAE or the CDC or the EPA to tell us yes, do this or that or the other.
All right, and this is from Jeremy Taylor. He says, if our customers' existing systems cannot handle a MERV 13 filter, are there any options in this program to utilize ionization filtration systems without the added cost of re-engineering an entire system?
So you won't have to re-engineer an entire system when you go through the checklist. When you get to those systems that cannot handle the MERV 13s, there are a host of other options there that they can implement. Ionization is not one of them, but there are other things that they can do there with your expertise to get them, more air changes, better filtration, the best that you can.
All right, it looks like we have a small HVAC contractor on the call with us looking for information on how they would go about getting on the approved list. So can you just recap the LARA information?
It's any licensed HVAC contractor. We did not create an approved list for this. We borrowed from sources that we're familiar with, and among those are the utilities. If you are approved through a utility now for their energy rebate programs, you're already on their list. If you're not, you can connect with your utility in your area and get on the list. And we just tried to provide those because we know that there are some that don't have an HVAC contractor they work with. Many do. So we don't have any list that we've approved as only these contractors or anything like that.
Perfect. And this question comes from Evan. My AHUs only have mixed outdoor air dampers, not individual intakes or exhausts. How do I know how often I've changed the indoor air?
That's exactly why we've asked licensed HVAC contractors to help us out. If you are up to code, they should be able to tell you where your system should be at as it was designed, and then help you make sure that it's performing at its optimal level.
All right, well, we're going to keep peppering you with some technical questions, Sean, but this one from another question from Joe McHale. After the business is certified, is there a plan for, I actually think we already had this one, my apologies, that one came up already. I'm going to go on to a question from Jeremy Taylor. In regards to my first question, is there any grant program to help our customers offset these costs? Not
currently. The grant program potentially is the $10 million the governor has requested. So the best bet now is if someone is making the decision to upgrade their system, definitely check in with the utilities, work with Michigan Saves on some of the pieces that they can do there. But there is not a grant program at this time. It's in the supplemental request.
All right. And is there a penalty for not participating in the HVAC upgrades? Will the state post a list of non-compliant restaurants, or will a list of compliant restaurants be posted for the general public to see?
So there is no penalty. This is a voluntary program. We encourage you to do it because it's an important step to consider. As I mentioned, it's not the only mitigation tool, but this can help for indoor environments. We have considered and may at some point in the future post a list of restaurants that have participated in the program, but we haven't made a final decision on that.
All right. And would a licensed plumber contractor be allowed to equip restaurants as well?
So we focused in working with Laura on what types of contractors are licensed to perform this type of work. On licensed HVAC contractors, mechanical contractors is a license in and of itself. So I would check in with Laura to make sure that you're authorized to do that type of work.
All right, and this is the last question we have time for. Will we be able to know beforehand if the funds will be available to us through the $10 million in addition to utility rebates before spending and/or financing?
So I think working with your HVAC contractor, you should be able to get a quote if you're going to try to make those types of improvements. I think when you have some time to look at the checklist, you're going to have sort of a host of opportunities to make some changes that may not be that cost prohibitive. Certainly, if you're upgrading the whole system, it can be quite expensive, and we understand that. And that's why we built out the checklist that way, to recognize that some folks are going to buy that Ferrari, some folks are just going to buy a commuter car. And hopefully you'll be able to see that. So if you get that quote, you'll be able to work with your utilities to see if you qualify for rebates. You'll be able to work with Michigan Saves on financing potentially. And then on the $10 million that's in the request for funding, we'll just have to see how that plays out in the legislative process. So in closing today, I'm just so thankful that you all have joined us. We've been talking about HVAC for several months out here in the Department of Labor and Economic Opportunity. Again, the links to those webinars are available on the Safer Dining site. I definitely encourage you to check those out because I know we covered it really quickly in very broad detail. A lot of great information in there put together by our friends in Michigan ASHRAE who actually did the webinars with us and went through all of that information in greater detail. This is an important mitigation strategy to consider. We knew and had heard in the news all summer that going into fall, there was some concern about us all going indoors. In Michigan, where it's winter, we are indoors. So just something to consider to help further mitigate the spread of COVID in our workplaces and our communities. Added together with those other mitigation strategies, we can really have a positive impact. And I am, very appreciative of those that will participate, and we hope that you'll consider it. And thank you for your time.